Well, hello, free people of the Rocky Mountain region. This is Brandon from Free State, Colorado, and I hope you're doing well. Colorado is among states that handed out $1.4 billion in Medicaid funds to illegals. Now, I know a lot of you who've been paying close attention to Colorado politics and especially our state legislature have known that this has been going on because we watch the bills. We see what these Colorado Democratic legislators are doing with our taxpayer money. They are ensuring that lots of our money, our taxpayer money, is going to provide health care, medical care to people who are in the country illegally. But this Rocky Mountain Voice article and kind of everything going along with it makes me think things are starting to change here. So this is from November 3rd, 2025. This article was originally published in the Federalist, which we'll take a look at here in a minute. But let's just look at some highlights here. 5 states and Washington, D.C. funneled more than $1.35 billion in federal taxpayer Medicaid funding to illegals, according to a preliminary audit of the program completed by the Centers for Medicare and Medicaid Services, CMS. CMS Administrator Dr. Oz, posted the results of the preliminary audit on social media showing California, DC, Illinois, Washington, Colorado, and Oregon spent millions each on illegals, with California spending the bulk, topping over $1.3 billion alone. Wow. It is crazy, folks, right? And then people wonder why there's problems with Medicaid, why there's problems with our federal government. It's because a lot of this money is just being given to people who aren't even supposed to be in this country, right? That money, according to Oz, was spent, quote, just in the last few months. Wow. The left constantly claims this does not or even cannot happen because it is against federal law to use programs like Medicaid, something meant for Americans, for illegals, but that small sample of states shows that states are defrauding the American people out of their own programs to the tune of billions of dollars. That claim is even more spurious considering the Democrats are only days away from breaking the all time longest government shutdown record because they care more about funding health care for illegals than citizens of their own country. This is absolutely crazy, folks. And I mean, it's so sad, right? It's so sad seeing Colorado on this list with California, Illinois, Washington, Oregon. My goodness, we should not be on that list. We have to do something, folks. Get involved. So, if you click the link here at the Rocky Mountain Voice, it'll take you over to the Federalist article. And of course, I always have everything linked at freestatecolorado.com so you can go in and do some more digging. Read this yourself. But yes, crazy stuff. This is pretty interesting too here. As Dr. Oz points out, emergency rooms are required by federal law to treat anyone, no matter their financial circumstances or immigration status, because of the Emergency Medical Treatment and Labor Act. Immigrations and Customs Enforcement ICE operations seem to have alleviated some of that pressure from certain emergency rooms notorious for being abused by illegal aliens. But Dr. Jared Ross, an emergency room doctor, said that illegals being kicked off Medicaid from the One Big Beautiful Bill could have the unintended consequence of turning them toward emergency rooms instead of going to general practitioners using insurance. So we'll take a look at that. I wanted to bring up that emergency room part because we'll see here in a minute. So let's jump over. So Dr. Oz, he posted this. This is what the article's about. This is his post on X where he kind of breaks it down. So we're going to go ahead and read through this. Buckle up for this one. Based on our initial set of audits, more than $1 billion of federal taxpayer dollars were spent on funding Medicaid for illegal immigrants, and my team is getting it back. Wow. Some want to deny that illegal immigrants are receiving Medicaid. Others insist it's illegal for Medicaid to cover illegal immigrants. And others accurately point out that hospitals can provide emergency services to illegal immigrants under the program. We can all agree on this. Rooting out fraud, waste, and abuse is essential to protecting this program for the most vulnerable. It's one of the Trump administration's top priorities. Let me lay down the facts. The truth is that federal law is supposed to prohibit federal Medicaid dollars broadly from being used to cover illegal immigrants. It does permit states to use Medicaid dollars for emergency treatment, regardless of patient citizenship or immigration status. States can also legally build Medicaid programs for illegal immigrants using their own state tax dollars, so long as no federal tax dollars are used, which is happening here in Colorado. But that didn't stop Democrats from going even further by breaking federal law to give illegal immigrants federal Medicaid dollars meant for American citizens. Earlier this year, the CMS team began auditing state Medicaid programs to ensure they were following the law and not spending any federal tax dollars on illegal immigrants outside of emergency Medicaid. What we found was shocking. In a preliminary review of 6 states, we found those states improperly using federal tax dollars for their allegedly state funded program in providing coverage to individuals, including some with criminal records of murder and assault. Yikes. Here's the states. Colorado's at $1.5 million. Wow. We notified the states, and many have begun refunding the money. But what if we had never asked? Whether willful or not, the state's conduct highlights a terrifying reality. American taxpayers have been footing the bill for illegal immigrants' Medicaid coverage, despite many Democrats and the media insisting otherwise. Democrats are demanding the repeal of the president's Working Families Tax Cuts legislation in order for their votes to reopen the government. This law wisely strengthened our ability to limit federal dollars from being spent on health care for illegal immigrants. Until Democrats explicitly drop that demand, they're blatantly holding the government hostage over giving Medicaid to illegal immigrants. So I really wanted you to see this because there's so much talk, of course, about this government shutdown, the Medicaid issue, and of course, Colorado's right in the mix, folks. I mean, $1.5 million in a state with a huge budget deficit. I mean, we have to give $1.5 million back to the feds because of this. Well, it's so interesting too because this article from Sean Boyd over at CBS News, it's like this is just days apart, folks. So that Dr. Oz post here, this is from October 31st, 2025. 1.5 million views posted at 7:22 in the morning Mountain Time. The same day at 7:55 in the evening, posted by Sean Boyd, Medicaid spending in Colorado is unsustainable. Governor Jared Polis says. So the same day, folks, Governor Jared Polis released his budget request for next year, and Medicaid will take a big hit. The governor says the health insurance program for low-income Coloradans is growing at nearly twice the rate of the state government overall. Wow, I wonder why that would be. I wonder if our illegal immigration sanctuary state status has something to do with it. Polis says if the state doesn't slow the rate of growth, the program will crowd out everything but funding for schools in the next few years. In the state, 1.2 million Coloradans rely on Medicaid. The governor says none of them will lose coverage, but what that coverage looks like will change. Polis's budget request hones in on what services Medicaid covers. Polis's budget would require prior authorization for more services, more cost sharing, and new payment caps. The governor says Medicaid is growing by nearly 9% each year, double the rate of spending on the other parts of the government. He says it's unsustainable. According to the Colorado Department of Healthcare Policy and Financing, long-term care for older adults and those with disabilities is driving the increase in costs. HCPF says it makes up about 5% of Medicaid enrollment, but accounts for about half the claim. The state spends about $16 billion each year on Medicaid, wow, which was projected to grow by $630 million this year. Polis's budget provides about half of that $300 million. Wow. So they're going to be cutting it down like crazy. I mean, that's the reality, folks, is our state government is spending an unsustainable amount, especially dealing with Medicaid and knowing that Colorado's giving some of those Medicaid dollars, not just from the state Medicaid, but federal Medicaid dollars to illegal immigrants. Now, let's do a flashback here, right? So, like I said, if those of us who've been paying attention to Colorado politics for years know that this has been a problem, right? This is CPR.org, June 7th, 2022. Colorado expands Medicaid access to undocumented pregnant people and their babies. So, part of Colorado's sanctuary state status is also providing government medical benefits and of all kind. Now, supposedly this was just supposed to be state-funded Medicare, but who knows? Who knows? Pregnant undocumented immigrants and their children will be eligible for Medicaid starting in 2025 under a bill signed by Jared Polis Tuesday. Starting in 2025, right as we're seeing all of this come to a head. So I thought this was really interesting to bring it back up here. And of course, you got some of the far left Democrats who, unfortunately, some of them are still around who really sponsor this. In addition to the Medicaid expansion, the bill immediately expands healthcare benefits for all enrollees. Medicaid and CHIP members will have free access to lactation supplies and support services like breast pumps. So, I mean, they just keep growing and growing. That's the nature of government, folks. You can't give them an inch because they're going to take a mile, right? Check this one out. Do you remember this story from the Denver Post? UCH Health reports $500 million in uncompensated care in 2023. So there's this huge crisis in Colorado with the medical expenses, right? You have our state government saying outrageously spending way too much money, getting caught giving some of this money to people who are in the country illegally. And nonetheless, $500 million in uncompensated care from UC Health. That can't last, folks. That cannot last. And this is from March 2024. Three factors increased uncompensated care: increased migration to the Denver area, Medicaid unwinding, and a new state law that allows people with incomes less than 250% of the poverty line to apply for financial aid. So it's like our government's causing these problems. The politicians here are 100% causing them. Do you remember this from last year as well? Uh, Ballot question 2Q that did pass, a Denver sales tax increase that could provide a lifeline for Denver health. The proposed tax increase would raise $70 million a year in hopes of stabilizing the city's safety net hospital and health system. So, I mean, Denver health is on the verge of having serious issues. UC Health, $500 million in uncompensated care, all these issues where they're getting a lot of people coming in who cannot pay. And I don't know if they're taking advantage of the system. Don't quote me on that. But nonetheless, it's definitely causing a serious issue. More than two-thirds of Denver Health's patients are covered by Medicare or Medicaid. So there's a lot of issues there, folks. Uninsured patients coming in, people like that. So this article just from a month and a half ago, September 25th, 2025. Make sure you saw this one too, because this kind of all these articles kind of wrap it all up, right? They provide the whole story of what's happening here with Colorado's medical system. And remember all of this when the government and the politicians come through and say, we need to increase your taxes, we need to take more of your money, we need to prop up the healthcare system because it's falling apart. Well, they're the ones causing it to fall apart. CBS News: Colorado emergency room and maternity units close as hospitals statewide hemorrhage money. The Colorado Hospital Association is warning of further cuts to services, saying the state's hospitals lost $4 billion on Medicaid and Medicare last year and saw a 60% increase in uncompensated care and a 13% increase in operating costs. Wow. Banner Health closed its emergency department in Loveland this month, and last week Delta Health became Colorado's second hospital in 5 months after Arkansas Valley had closed its obstetrics unit, like obstetrician. Half of rural Colorado is now considered a maternal care desert. So, I mean, what are they going to do? They're running out of money. Uh, they're losing money from the federal government. There's a lot of issues there. There's a lot of people who are in the country illegally that this money is being spent on. The feds are coming in. I mean, it's a disaster, folks. And this is one of those reasons, another example of how dependency upon the government it leads to disaster, right? Because we know what's going to happen. We're going to see it from all our state government legislators, all the Democrats, come January 2026, who are going to talk about this Medicaid, hospital, medical emergency, healthcare emergency, where costs are skyrocketing and nobody's going to get the care, and they're going to push some extreme stuff. They're going to push a single payer healthcare system in Colorado that everybody's going to pay for. Can't let them do it. We cannot let them do it. We got to call them out and we got to hold these people accountable. Check this out from February of 2025. Colorado paid more than $7 million to insurance companies for care for dead Medicaid members' audit fines. So not only are we giving, $1.5 million of federal money to illegal immigrants, how much of our money from taxpayers who are here legally or American citizens is going to illegal immigrants, and then $7 million to for dead Medicaid members. State disputes findings does not plan to refund $3.8 million in federal funds used in payments from 2018 to 2020. So, folks, government dependency is a fragile system. It's not a sustainable system, and eventually it's going to come apart, right? We know our country's in financial stress. We know there's a lot of issues out there. The economy is not very certain. And all of it, I really have to say, is because our federal government and our state government is mismanaging things to the point where it's falling apart, and employers and high income earners, everybody else is being punished. They're being attacked and they're trying to steal every penny they can from people, every person they can, especially people who are making good money to try and keep the system propped up. Check this one out. 21,000 undocumented Coloradans could lose Medicaid coverage under Trump tax bill. And this was before the One Big Beautiful bill passed. This was July 2nd, 2025. But that's crazy, folks, that there's 21,000 undocumented people in Colorado who are under this Medicaid program. They're not even supposed to be getting Medicaid money from the feds anyway. But now, I mean, it's a disaster. You can read all this yourself at Free State Colorado, but I had to end on this, had to bring this one up. Fox News, September 5th, 2025. Colorado Democrats steer millions of to Planned Parenthood as multi-million-dollar deficit looms. Republicans criticize priorities as lawmakers defer $300 million in spending cuts to governor. Colorado Democrats approved millions in Medicaid reimbursements for Planned Parenthood during a special legislative session last week, even as the state faces a projected budget shortfall of up to 1.2 billion. Crazy. Colorado Democrats pushed Medicaid reimbursements for Planned Parenthood and tax credit financed health insurance subsidies while deferring substantial spending cuts to the governor. So, how much money is going to Planned Parenthood as well. So, I mean, it's like, folks, this is the inevitable consequences of the system we have when there's one party rule in our state government. Needs to change. Got to get involved now. We got to start speaking up. We got to talk to our neighbors, get organized for 2026. Things can change. It's going to have to change, right? It's just ultimately who's going to offer the best solutions, right? We're seeing this, right? We're seeing this in New York. We're seeing it here in Colorado, where you have the far left and all these socialist types who are presenting their solutions, right? They say, okay, healthcare is unsustainable. We need to create more government healthcare, right? Kids are not going to get their school lunches. We need more government provided school lunches. We need to take more tax money. We need to steal more. There's housing issues. We need the government to control housing. This is what the socialists are promising the people of Colorado, the people of New York, the people of America. They are wrong. It is going to end in disaster. I mean, everything we went over here is a result, an inevitable result in my mind, for these socialist type policies. It's going to fall apart. People are going to keep falling for it unless they're presented with an alternative. So if you believe in liberty, freedom, if you understand how free markets and can improve the economy and create a system in which we are the wealthiest country on earth, the most opportunity to have anybody, we have a duty to speak up, to get involved, and use our voice. So appreciate you joining me today. Again, Brandon Work from Free State, Colorado. Take care. We'll talk soon.